And good afternoon. Actually, it's rolling in the evening over here. So, good evening, everybody. It's Art Shed with the Shed Group, MedicareHelpGuides.com. That is the website. Today, folks, we're just going to jump right into it. I don't want to hold you long. I don't want to hold you any more than 10 minutes, but we'll see how we do with this particular discussion. Today, we're going to be talking about Medicare Advantage in 2024, enrollment up, and some key trends. This is by Kaiser Foundation. If you know anything about Kaiser Foundation, you know them to be an independent source for health policy research and polling the news. So they do a good job of keeping everyone in this space, the healthcare space, kind of abreast of what's happening, not only legislatively, but what's happening with hospitals and providers and you name it. They are on top of the industry. So I like to use them as a source, and that's what we're going to do today. But before we do that, I do want to take you over to the website just for a second. Just want to remind people that, hey, if you have questions regarding your Medicare or regarding healthcare during retirement, we're here to help answer those questions. You know, for us, you can get up to $500,000 for healthcare spending during retirement. This is for money for Medicare, money for long term care services. You don't necessarily have to have a long term care policy in order to get money for long term care services and some help along the way because we're here to guide you through this system. We know, again, that it's kind of a daunting situation. Healthcare during retirement is, especially Medicare, but it's our job to kind of navigate you through the system. You know, I tell a lot of people that for the most part, we sit at a different vantage point than people that we are sitting down with. You're on the precipice of a lot of these items. I and people like me that make up the Medicare Help Guys group, we are sitting back here actually kind of watching the show, right? So we're able to provide you with what we call some Monday morning quarterbacking when it comes to which way you should be going when you're looking at healthcare options and the rest. So, if you need a consultation, you can schedule a consultation. You can set up a meeting by Zoom, or if you want, just give us a phone call. If you do a phone call, you can just get on the calendar and find out what works best for you, what works best for us, and we can go on down the road from there. But it's our job to be able to help you. That's the main point. We're here to help you because we know, again, these decisions aren't easy. So we're here to help. All right. So, with regard to this particular article, I mean, it speaks for itself. What I am going to do, I enlisted the help of Google Gemini. And I put in the prompt to give me the top 10. I mean, the article really isn't that long. However, it does go into a lot of granular detail on a lot of different things. So, what I did was ask Gemini to provide me with the top 10 items. And then we'll look at those items and I'll kind of commentate as we go as I see things that may need to be further addressed. So, when looking at this particular story by Kaiser Foundation, top bullet point that they start with is that enrollment for Medicare Advantage plans has steadily increased over the past 2 decades. So they've gone from 19% in 2007 up to 54% today. So there are a lot of people, large number of people aging into the Medicare system today who are choosing the Medicare Advantage plan versus the Medicare supplement. I can tell you, I've been doing this for 20 years. There are a number of people picking the Medicare Advantage route because of what they may have in their 401k and other planning. That's one item. The other item is they just know they don't utilize a whole lot of care. So why spend a ton of money on health care during retirement when you don't really spend for care that much? All right. So those are the two main reasons that the enrollment, I believe, are up. We can talk about what other people may see as well, but those are the two general factors. The other next bullet point down, the growth is due to factors including additional benefits and lower out-of-pocket costs. Medicare Advantage plans typically offer additional benefits such as dental, vision, and hearing coverage that are not covered by original Medicare. They may also have lower out-of-pocket costs for certain services. So, a certain service, for example, let's say blood work. Um, Blood work can cost you really about $600 or $700, but with a Medicare Advantage plan, in most cases, depending on the carrier, it's probably zero. So that's an excellent savings, especially if you're the person that goes back and forth to your providers, plural, 2 or 3 times a year, and they all need blood work. So think about that. So, and the other piece with regard to dental, vision, and hearing, just remember Medicare doesn't cover dental, vision, nor hearing. And so these items are rolled into most of the Medicare Advantage plans. And guess what? I mean, I'm going to tell you, even the offering that is offered by most of the carriers in their Medicare Advantage plans, they're not that robust. Okay. If you think about the average cost to get a root canal, it's probably about $3,400. In most cases, maybe you get $2,000 in your plan. So you still have some out of pocket spending, but you have some money set aside for it. When it comes to eyewear, I think everybody provides you with some form of a discount or some form of a credit when it comes to the frames, and maybe they pay for lenses or something like that. So there's a number of different variations, but several factors that make Medicare Advantage popular. However, Medicare Advantage plans are higher than the cost is higher. Payments are higher than traditional Medicare for similar benefits. This is because Medicare Advantage plans are paid a fixed amount per beneficiary, regardless of how much care a person may use. I generally, when people ask me the question, um, how do you guys get paid? And I generally tell them, this is Medicare Part A. That money is given to the provider at the beginning of the year, to the tune of really, I think it's like, depending on the region where you are, it will change. The amount will change, but I think the average is still like, I think it's about $6,000 per member. So they get a check, the carrier does, for about $6,000 per member for your care. And you may not use much in the way of care. In fact, the average healthy individual, really between age, let's say relatively healthy, between age 65 to 70, you know what? In most cases, you're not really having a whole lot of health care issues, right? If you look at that particular crowd, when you look at the CMS data, relatively healthy. Okay. At best, your average spending is somewhere around $500 to maybe $600 a year. So, not a whole lot of spending going on there. So that's how they make their money. Let's see. Next bullet point. There are also wide variations in enrollment by county. That's correct. Some counties have more than 70% of Medicare recipients living in them. Other counties have a lot less. Some have lesser than 20%. That's what this piece says. This variation is due to a number of factors, including availability of plans, demographics of population, and market practices of Medicare Advantage plans. But the other piece that they leave out, they should also tell you that where there is low where there are, for example, if you live in counties where there is no provider, or there you have a limited number of providers, highly unlikely that you're going to see a large preponderance of any type of Medicare Advantage plan. Okay, so where you are geographically matters when it comes to Medicare Advantage. There's a map on this page that they kind of talk about that. See if I can pull down to it. Here we go. Yeah, they talk about share of beneficiaries enrolled in Medicare Advantage plans 2024 by state. See, in the state of Indiana, it's like 52%. So 52% participation in the Medicare space are people who have Medicare Advantage plans. Okay. Lower participations, for example, like Kansas, 35%. Again, where you have a large rural population, more likely that you don't have healthcare systems in order to support what the Medicare Advantage model has to offer. Okay, so that's where that comment comes from. So back to our bullet points, the number of Medicare Advantage plans have grown rapidly. In 2024, there were 4,000 Medicare Advantage plans available compared to 1,500 in 2007. So yes, it has grown tremendously. And for a lot of people, I'm gonna tell you that it cuts both ways. It's a benefit, and the fact that you're probably spending more money, although they'll the heads around CMS will tell you that Medicare Advantage, when you look at the cost savings, it's there, but you're spending some money in order to get that type of savings. All right. Anyway, the average premium for a Medicare Advantage plan in 2024 is $19 per year. In 23, it was 20 in 2023 it was $23 a month. However, it's important to note that premiums can vary widely depending on the plan, the beneficiary's location, and their health status. That is true. Major Medicare Advantage beneficiaries, the majority of Medicare Advantage beneficiaries are enrolled in HMO plans. This is true. There is a large number of people enrolled in zero premium plans. Most of the zero premium plans that are offered are HMO plans. United Healthcare does have some PPO zero premium plans, but I caution everyone who uses the HMO as a model because it could create some issues for you, especially when and if you're out of network. If you're out of network, just remember that you're responsible for that cost. And just note, if you're in a PPO plan and you have providers that go in and out of network, because that happens too, right? If they're out of network and you're in a PPO plan, you still only pay a co-paid amount. But if they're out of network in an HMO plan, you're paying the full amount. Okay, so for most people, you have to keep that in mind. Medicare Advantage plans are becoming increasingly popular among younger beneficiaries. Yes, older beneficiaries, let's say my older baby boomers, which is interesting too, because they started in Medicare supplements. And I got to tell you, I get a large number of people between the age of 75 to 80 who are coming to see me lately. They're moving from their Medicare supplement to a Medicare Advantage plan. And in most cases, when I ask the question, why are you making this change? Because it's not up to me, it's up to them. When they tell me their answer, I'm surprised, but I guess it fits a pattern. And what they tell me is that it's just become too costly. So when you have the Medicare Part B, and you can think about it, people who retired in, let's say, 2007, took their Medicare, they came in and the Medicare Part B number in 2007, man, I think it was like $79, something like that. So $79 now, it's 174.70, right? And planning to go up, I think, next year, 181 and some change. Look, for most people, the Part B is taking a good chunk out. And when you saddle the Medicare supplement and the standalone Part D with it, on average, you're spending about $360 additional. Okay, so you have to think about that. And when I say the average 360, that's taking what a person spends at age 65, what they spend at age 80, do an average over that 15-year period. It's about $360 a month. That's a lot of money. So I'm often I guess I scratch my head at the state of the economy and everything else when I have older people who do come see me. But yes, younger people are choosing the Medicare Advantage route because, well, it's just more cost effective, especially when you say the average Social Security benefit is $1,800. That's average. Okay. They're trying to hang on to as many dollars as they possibly can. So why tie it up in a Medicare supplement? Those are premiums that will be paid every month, right? A Medicare Advantage plan, you pay a much lower premium, but you may not have a health care issue or you may not have a health care incident, right? You may not have a need to go to a doctor this month or next month or whenever it may be. For most people, that group 65 to 70, you're only going one to maybe two times a year. You're doing your annual checkup and you're doing your wellness, and that's about it. Maybe there's a follow up in there, but that's it. So think about that. Anyway, We're getting down to the end here. The use of telehealth services has increased significantly among Medicare Advantage beneficiaries. That is true. Since COVID, the number of people using telehealth, people don't even want to go out and go anywhere. I'll talk to my doctor over the telephone or over a Zoom call or whatever it may be. Just see it happen. The outlook for Medicare Advantage plans are and is, but it says positive. Yes, it's positive for a number of reasons, but for the two main reasons I gave you earlier. Two main reasons are it's cost effective for a number of people. If your average Social Security is 1,800, you don't want to tie up $170 plus an additional $360. I got a dog here looking for some attention. You don't want to tie that up in a Medicare supplement plan in a Part D. So buying the Medicare Advantage is the best economical value for their dollar. Is it right for everyone? No, it's not. I have a number of people who come see me. In fact, I just had a conversation with a lady today. She wants to go to a Medicare Advantage plan, but she's had a couple strokes and they don't really know the reason for the strokes. I think she's a better candidate in a Medicare supplement, but she may decide to do something different, and we'll find out. So, folks, look, just wanted to point this out to you. I do believe that this is a good article. If you want to spend some time reading it yourself and looking at all of the little graphics that they do have, I will point out that when it comes to participation in a Medicare Advantage plan, you do see United Healthcare has the largest enrollment at almost 9.5 members million members, 9.5 million members in the Medicare Advantage space. United Healthcare is the biggest carrier in this space when it comes to Medicare Advantage and Medicare supplements. So keep that in mind. I do often tell the story why I am a broker. However, I really spend most of my time selling United Healthcare. And the biggest reason is because it's stable. And when you have, 9.5 members in a Medicare Advantage plan, it makes the premium stable. It makes the plan design stable. It makes your look and feel and your ability to be comfortable stable. So, and that's what we want during your retirement, your healthcare spending during retirement. We want it to be a stable environment, not a whole lot of topsy turvies, right? Right. So, very important. Take a look at the article yourself. If you do have any questions or comments about it, put it in the comment section. I'm willing to kind of entertain that because I'd like to know what everyone else thinks about Medicare Advantage in particular. And if you have any stories to tell, I would like to know them as well. So, folks, that's all for the evening. Hope you enjoyed this. We do look forward to the next one. Take care.